By the way, I brought an illustration pen just to show you. This is the Lily, the zip bound. It's extremely simple.
And Monjaro, same thing.
Yeah, the same pen. You don't see the needle at all. When you take this off, you don't see the needle. You just put it on here, and you just turn the dial, so you open it because it has the lock here. You put it on your stomach or your thigh and just click till you hear the click, and the medicines in.
So question, thank you first, I think for taking the time.
Absolutely.
So let's say, can you target like a specific area in your body, like, or does it work for everything, or let's say like you have a concentrated fat from
No.
Hawas,
No.
Does it or not? Just
No, it does not. No, this is to lose weight and fat throughout your body.
okay.
Yeah. So it's not that you inject in one place where you need it to work.
Okay.
To answer the questions, no. This is for weight loss in general. This is not for focal areas.
Okay.
Absolutely.
Is that the same one like they use it for, I believe, insulin or something to increase or I believe?
Yes.
People are injecting.
Well, Manjaro is the same as Zepbound for diabetes.
Okay.
The same molecule, same pen, the same everything, the same dosage.
Why change the name?
Because for indication, the insurance company and the FDA, they have to give it different thing. That's why. But it's exactly the same molecule.
That's yeah. Exactly.
So Monjaro and Zepbound, identical pen, identical everything. Only the name here is different from between one and another. One indicated for diabetics and the other one is for overweight. Same thing for Ozempic and Wegovy. Now, Ozempic and Wegovy, the dosage is a little bit different, just a little tiny bit, and the pen doesn't look like this, but it's also very easy to use.
Any side effect or like for long
GI,
time?
nausea,
Nausea.
غثيان, istifrag, some constipation or diarrhea. I've seen both. Yeah, constipation. Yeah. But nausea and vomiting is the
Arabic?
almost. But then decreased appetite. That's why we're giving it, obviously. نعطيه العالم عشان appetite. Go ahead.
I have a question. So for those who are taking the drugs for weight loss strictly, how do you wean them off of it, or are they going to take it for life, just like if you're a diabetic?
Well, the problem is, I'll let you talk about that. Because also I was in a lecture recently about these medications. The chances are, yes, you need to stay on it for the rest of your life, unless you change your lifestyle significantly and you get used to how many calories you're going to eat a day and how much exercise you're going to do. So if you stick to that without the drugs, then what بتوقفي الأدوية بدهم يرجع l'appetite. But if you have the willpower to continue to be on the same diet, the same amount of calories, same exercise program, most likely you'll be able to wean off. Otherwise, you're going to gain the weight again, you're going to go back on it.
So the follow-up question to that, if I'm not diabetic but I choose to take it, I was approved and everything, is that going to cause me any side effect because I am not sick?
No.
I'm just
The beauty of these drugs, it doesn't cause hypoglycemia. And that's one of the major things for diabetes management. If your blood sugar is not high, it's not going to bring it too low. It's really magic because all the other diabetic medications we have, if you don't eat, your blood sugar will drop down. If you take insulin and you don't eat, your sugar is going to dip down. With these drugs, if you don't eat, you're not going to go hypoglycemic or low blood sugar.
So this هذا السؤال there is this ongoing study انه بعد ما يوقفوا هالدواء وشو بيصير بعدين more than likely people gonna gain weight وغالبا بدهم يضلوا على شيء اسمه maintenance dose يعني يا يوطوا الدوز او شيء so هدول لسه ما عندنا هالداتا لسه لحتى هذا بس غالبا هي اللي بيطلع الداتا.
تفضل.
How safe are those drugs for cancer patients?
The only patients who cannot take it if they have a history of medullary thyroid cancer. Is that correct?
Correct.
But besides that, there's no other, nothing in the study so far showed that increase any other risk of cancer. Medullary thyroid.
So those medications or it is precursors صار لهم على الماركت بانه في من قبل بلشوا اسمه بيرا هذا اول دواء بلش هلا ما عاد حدا استعمله لانه كان مرتين بالنهار هذا صار له على الماركت اكثر من 20 سنه صار له 22 سنه بقى الداتا كلها انه سيف هلا باستثناء ميدلري ثايرويد كانسر قديش بيشوفوا العالم ميدلري ثايرويد كانسر؟ انا بشتغل بالثايرويد، هي شغلتي يعني. انا عندي باخر 20 سنه صار شايف مريضين، يعني الكانسر هو ذات نفسه كثير نادر يعني.
Very rare cancer.
What if it's not thyroid cancer, but you have like either hyper or hypothyroidism? Do you mess with that, or is it?
Not at all. Has nothing to do with it.
And then in terms of getting like people in your office getting people approved, what if you need to lose like 10 pounds for your BMI? Like, is that something that they would approve?
I would definitely recommend against medications if it's only that small amount, because easily you can change your lifestyle
Right.
to get to that goal. Because they have side effects. Some people, I've had patients, again, not very commonly, but I've had patients couldn't tolerate the smallest dose. They would throw their guts out. And I have patients on the highest dose and they don't feel anything. But if you don't have to do it for 10 pounds, I don't think drugs is the answer, honestly. That's not, don't pick the easy way out, basically. That's,
I'm
you
just
know,
asking
not you,
about-
but in general, to lose 10 pounds, just exercise. You got a guy who will teach you exercises.
If I may, I had excellent experience with Weight Watchers. يعني Weight Watchers as a program, excellent. ما بعرف إذا متذكرين أوبرا she lost 40 pounds.
She's off their board now.
Yeah. She lost after she bought stocks after she lost the money. So هذا Weight Watchers an excellent program وبتاكلي الاكل تبع البيت، ما بتاكلي الاكل تبعهم. So really in reality it's an excellent program. هلا مع الميديكيشن اذا حدا بده يخسر كثير الكومبينيشن works very well. انا ما بعرف اذا لازم اقول هالشيء او لا، بس من ناحيه لنقول انه الانشورنس ما غطى. ما حدا بده يسالني هالسؤال؟ ما غطى الدواء. هلا انا لانه بشوف شو
You want me to answer?
answer.
So there are some compound pharmacies that are using the same molecule. They usually mix it with B12 because it cannot be exactly the same molecule, and the dose will be a little bit different, just tiny bit. So they won't legally be liable, and the price is much less. Usually, my experience, actually, I have a nurse practitioner who's starting with me next week, and she's done this in the previous clinic. So I might put together a program in my clinic actually for that, because to be supervised for diet, nutrition, and medications. But the numbers I looked at, instead of this drugs, correct me if I'm wrong, about $1,200 to $1,400 a month.
For injection?
Right,
per month.
per month, and so 4 injections. Usually the compound pharmacy ones, you can get it for $300, $350, something to that extent.
في
And they do have the same effect.
It's the same thing.
The same.
It's the same molecule exactly. But they might mix it with something very benign like a B12, small dose, because by the FDA, since this is branded name, they cannot make exactly the same one. So,
في other option.
go ahead.
اوروبا. في عندي مريضه انا رومانيه بتجيب اوزمبيك من رومانيا كاش $250.
Well, I'm sure Canada's cheaper.
او كندا. يا كمان هاي هلا بما انا في بس في شغله ربا ربا الفرق بين مصر وبين رومانيا انه رومانيا عضو بالاتحاد الاوروبي، على القليله الدواء يعني مضمون. هلا صحيح بجوز يكون من برا كله نوفو نوردس وكذا وهيك، بس ما بعرف ليش يعني في كثير تسمعي قصص هوني. يا سو ذاتس انذر اوبشن.
Go ahead. Khalid.
بده برات الدواء؟
امم
بده برات الدواء؟
Yeah.
احسن.
But it's
هلا
also
مو
legal.
برا، يعني اذا بتحطه مثلا بتحط جنبه زيب لاك وبتحط اذا مسافر انت حطه باللاجج بالطياره من تحت بارده. اذا بتحطه اذا بدك تحط هذا زيب لاك وفيو كيوبز اوف ايس will do it. Just keep it cool.
Go ahead.
So I'd like to build my question based on a case study. Let's assume you have a patient that comes and sees you. This patient is 275 pounds, is 5'10", has been suffering from obesity for years. He consumes, let's call it 3,500 calories. Comes and sees you, you diagnose him with obesity, he gets approved by the insurance company, and he is prescribed one of these medications. He starts the medicine, and he takes it on a weekly basis as described in the dosage. However, his calorie intake does not change. He still consumes 3,500 calories. Based on the information that you shared with us today, is the medication doesn't attack fat tissue. So how would the medication help somebody who has consumed the same calories for years that come and see you? He has not changed his lifestyle. He is on the medicine. However, his calorie intake is still the same at 35 calories.
So based on the studies, the medicine will make him decrease his intake. لأنه it causes that you're eating 3,500 and you're not emptying your stomach. Again, the medicine doesn't work for everyone, but the majority it does. So 275 pounds, based on the study, he will lose about 25 pounds, around 10%. Now, this is the max he can get out of the medication, given we titrated the medicine all the way up. Now, so his intake will go down. Again, not everybody respond.
I have seen patients from diabetes more than weight loss, because we've had these drugs for diabetes much longer, and they did not lose any pound, and I was shocked. But I think the reason is, to answer your question, if they're eating less but the same amount of calories, and they won't lose much. They might lose probably 5-10 pounds, could be 20 pounds, but I agree with you, because this is not burning calories. So it's not that they're taking this to burn calories. For example, Adipex is one of the stimulants that we have. Stimulants stimulate the body, increase heart rate, increase metabolism. So patients will lose weight even though they eat the same amount of food. This one is not stimulant. So decrease intake and gastric emptying, and decrease the appetite because it works on the appetite center in the brain. But if the patients change their eating habits to more carbs, which has more calories, and keep the same amount of calories, there's a good chance it's not going to work that well.
So we can all agree that a lifestyle change on the medicine is a must.
Absolutely. This is how I
Absolutely.
What I want to share with everybody in this room is 1 pound, to lose 1 pound. 1 pound is 3,500 calories. That's why it's equal to. So if that patient is not reducing their caloric intake, which the medicine is supposed to help them reduce the caloric intake, most likely they're not going to see changes. So calorie reduction is part of the process.
Absolutely. Good point.
No.
Any side effects on the liver?
No.
Pancreas, yeah, could cause pancreatitis.
And the kidneys, hold on, because that's a very common one for diabetic patients, because we use it for diabetes. So a patient on stage 4 kidney disease, which is just short of dialysis, you can put them on these medications. Has no effect on the kidneys, but pancreatitis, it could increase the risk of acute pancreatitis.
Actually, your question, maybe I missed on that part. So how does it work? Like, this medicine, what does it do? Like, is it like?
So put that slide up. Yeah, he didn't go into the pathophysiology because we didn't.
Because I mean, like, if you still eat the same exact calories, you don't do the calorie deficit. It's not gonna help you.
So there are 2 enzymes. That's why it's called GLP-1. What is that slide? It's not projecting.
It's on a different one.
Get out of it.
Go ahead and
So there are 2 enzymes in the guts.
Here it is.
The GLP-1, which Wegovy works on, and the Zepbound works on the another enzyme. Those 2 enzymes are responsible for all these functions in the organs that you see, which is the brain, the pancreas, the insulin secretion, the pancreas, the stomach emptying, and the steatosis in the liver. So that's how it works basically. It simulates these enzymes, so they work much better, and that's why.
So it helps you like to don't feel like you feel full.
Exactly, you feel full right away.
So
That's
this,
why people think it's a side effect. That's why some people stop using it, because they feel full and they think they cannot tolerate it. Well, that's the function of the medicine, basically. So education has a lot to do with it. When we put patients on and we try to explain to them what to expect and when is the time to stop it, or tell us what's going on, so we tell them how it's working, basically. Pardon?
At what age can you start? Because I have a friend whose daughter is like somewhat young, and they put her on it, and she didn't lose weight. It caused some anxiety and depression in her. Have you heard that or seen that, or has it been documented at all?
I haven't seen anything about anxiety or depression.
Then what-
Actually, it's the opposite. Because of the weight loss, a lot of people have good affect, on their mental state.
Sorry, Fouad, but there are some studies are coming out that it does has something to do with anxiety and depression. But now, is it the medication or just coincidence? We don't know. But what's the age? I don't treat children. I treat only adults. So I wouldn't start it on somebody who's younger than 18. Now, looking at the epidemic of diabetes and all that obesity, I would assume even at the age of 12 to 13, if somebody is really morbidly obese,
I'm sure there are studies going on in kids, so we'll see what comes out.
Yeah, I have a patient who's 12-year-old.
Mhm.
The dietitian put him on Wegovy.
Yeah, I wouldn't be surprised. Yeah.
Well,
Well,
he's
Yeah, my daughter, she told me her friend, they started taking Ozempic.
yeah. Dr. Hanish, she's specialized in
yeah.
obesity in pediatrics. She does do that.
I have
What?
a question. I wanted to test and see how easy it is to get the drug. 2 days ago, I went online and I filled the profile in 2 different ways. When I put myself as a high weight obese, basically, I reached the point where I was going to be approved. I just had to enter my name, but it says I need a prescription. They were going to sell me the drug. The second time, I put my weight as like you said, like I just want to lose 15 pounds, and the system tried to convince me like to fight.
Which system are we talking about here?
I just went online to buy the medication.
Okay.
I know, we should,
Is it pharmacy online service?
Online, yes.
So let me tell you how when it started and what's going on right now, because we deal with this every day. And it becomes obviously you all know everybody's talking about it. So when they first came out, or before Zipbound came out, when Manjaro hit the market for diabetes, everybody used it for weight loss. So you cannot find the drug. And the insurance companies did not require a diagnosis at that time. If you got a prescription, you get it. Well, that changed because, again, diabetics could not find it. I write it for diabetics and they cannot find the drug. Ozempic is the same thing. But now the insurance companies require a diagnosis. So they need you to know your BMI and your other disease, your chronic diseases. So we have to attach it to something. Then every patient, every insurance, they need the prior auth.
Don't they also need that you tried diet and exercise and failed?
Some of them, no, not necessarily. There is a prior auth, requirement. So I have somebody in the office that's not only her job, but really a good portion of the day that's what she does. Gets prior authorization for these drugs. And we're able to get them. All they need to know is your BMI or if you have other chronic diseases. If you're morbid obese if you are over 30 and your insurance coverage includes weight loss medications, you'll get approved for it. If your BMI 27 with chronic diseases, the chances are you get approved for it. If you have that coverage though. Some insurances don't have that coverage. The question is again, where do you find it? My experience is you go to smaller pharmacies. Mom and pop pharmacies. If you go to CVS, good luck, you're not gonna find it. So those pharmacies put orders in and they have a list of prescriptions and they go by, which one is first. So they get a dose of Wegovy starting dose, they go ahead and give it to the patient. And Zipbound is the same thing. The starting dose of Wegovy, the problem, the higher doses are easy to find. But Zipbound, some dosages in the middle that's hard to find. 7.5 and 10 milligrams is very hard to find. But we're able to find it. But it might take some time. The problem is if somebody is on 1 milligram of Wegovy and now you cannot find it, that's the problem. What do you do? Because they have to come off the medication. So sometimes what I do, I go down a little bit on the dose because we found the dose, the smaller dose, get them on that till we get the 1 milligram, then go back up on it. Just we're playing the game around the system to make sure the patients have them. Go ahead.
I don't know much about medication, but again, intermittent fasting simulates some of the effects of those medications.
Farah.
Actually, no. The intermittent fasting and those medications are two different things. Now, when you do intermittent fasting, when you take your calories, do you take your entire day calorie in one meal and you don't the other, or that one meal a day that you eat is less calories? If it is less calories, obviously you're going to lose weight. But if it's going to be the same, the thing is the body doesn't like that starvation, starvation status. But intermittent fasting and those medications, they work totally different. This one here blocks your appetite. It makes you less hungry. That's basically the bottom line.
Which is in a way, you know, a lot of people love the intermittent fasting. You're starving your body basically. You can burn the calories and some of the fat you have. That's as simple as that, if you want to make it simple. But this one is you have normal lifestyle. You eat anytime you want, you eat your meals, you eat your snacks. It's just if you pick the right food and you got something to help you to decrease your appetite, then you lose the weight and have normal lifestyle.
I'm not sure, like, one fact about intermittent fasting is, that's what I've been told, is like increase your, what's it called, like, burning, metabolism. So is it?
Yes, it could. But again, you're putting you in the starvation mode basically. So when you're starving, that some people don't eat for 2-3 days. They have to use basically the storage that they have in their body. That's how you lose the weight. I mean, in simple, you know, statement. But I'm not big, I don't advise it really that much. You could lose weight. Well, first, let me take that back. If that would work for you and you lose weight on it, I want you to lose weight regardless. You know what I'm saying? If that's the only way, you tried many things and this is the only way to lose the weight. But I'm a big believer that the diet has to be a reasonable diet that you can do forever. Not to lose the 20 pounds. I've seen so many people, friends of mine and patients of mine. They go on starvation, on intermittent fasting. They lose the 10, 20 pounds. They're very happy. They get tired of it. They go on vacation and they're like, I'm going to eat, I'm starving. I want to enjoy it now. They enjoy it. They get the 20 pounds in a week. And then they go back again on intermittent fasting. And that's their lifestyle for the rest of their lives. So it's better to improve that.
To just echo on what Fouad said, I have a diabetic and he's very, very well educated. Comes to me, sugar is high, A1C is 11, that's it, I'm going on a diet. The next one in 3 months, perfect. He's fine, okay. The 3 months later, he comes back and he's 11 again. So he's going on that yo-yo all the way. So you have to do something that you can do for the rest of your life. Yani, intermittent fasting is not going to work for you. This is not how your body is created.
Well, it's just like during Ramadan, people will lose weight and it's half on.
Right.
Do they lose though?
Some people eat.
Some people do, but they give themselves a great anything they want.
So you're dehydrated.
So that's the same concept.
But still, even if you are the ones who lose weight, they literally put it on and then some a week later.
Right.
So I haven't found, I personally don't lose weight at all.
Yeah. Yeah, because you can eat more in the hours when you're allowed to
You
eat.
drink more sugar too when
Absolutely.
you're exhausted and tired.
Right.
Because you're,
Absolutely. Any other questions? All right. Thank you very
Can I
much.
just, there is one more thing. If none of that works, there is surgery still. That's the other option for weight loss. I'm not a surgeon. I don't do surgeries, but that's the other one. Other option.
They could, but they do work. Surgeries are very effective, no question about it. But again, the question is, do you want to go that route if you're able to take a shot or at least improve your lifestyle? All right, thank you very much. Thank you.